Hey everybody, I want to talk about the muscles of scapulothoracic movement. Very exciting. So if we think about all the muscles that move the shoulder, we can broadly categorize them into two big groups, glenohumeral movers or movers of the humerus, and scapulothoracic movers of the scapula. So if you think, if you're studying kinesiology and you ask yourself, what muscles insert on the scapula? And I'll give you a minute. You can pause the video if you want. But think about what muscles attach to the scapula. What muscles might originate around the spine or the ribs and move out towards the scapula to move the scapula, the shoulder blade. So ask yourself that. Okay, so we're back. So I can think of 5. Let's take the biggest one first, the trapezius, right? The trapezius, the big, very superficial diamond-shaped muscle on the back. So the trapezius is really unique. It originates on the back of the neck, down the spine, and its fibers go out to the scapula and scapula, the spine of the scapula, the acromion process, and forward here to the distal third of the clavicle. So it makes this V or U shape in its insertion, almost like Superman's cape. It's coming this way, or like my sweater here, comes around here, spine of the scapula, acromion process, distal third of the clavicle. So it's going to, well, the upper fibers are going to elevate. The middle fibers are going to adduct, adduct, bring the scapula together in the back. And the lower fibers together are going to depress. So, move inferiorly. So the upper fibers of the trapezius actually act as an antagonist to the lower fibers. It's interesting. So what other muscles can you think of that attach to the scapula? So there's Pec Minor. Maybe you thought of that. Pec Minor, from the coracoid process to the ribs. Can actually move the scapula forward a little bit, or protract. And Serratus Anterior, really a big stabilizer. It it comes from the ribs to the medial border of the scapula, kind of slides over here. So it's really kind of fixing the scapula to the ribs, and you can really feel that working when you're pushing against a wall or doing a push-up or something, and you want your scapula to be that sturdy base on the ribs. That's what Serratus Anterior does. What else? Oh, we've got 2 more. Levator Scapula. Levator Scapula, right? Its name says that it's a scapulothoracic movement. It's, I call it elevator scapula. It elevates the scapula. And at the same time, because it attaches to this part here, it lifts and it downwardly rotates. So it's like a teapot. It kind of tips the glenohumeral joint downward. So it downwardly rotates as it elevates. And last but not least, there's the rhomboids that not only are they running obliquely so they can lift a bit, but they're also adducting and rotating. So that's it for those.